We're talking about climate change, environment, and public health, how they interface on the ground and what it means, especially in countries that are developing without sufficient mechanism to cope with the shocks of climate change. This study is in Nigeria. But then that briefly tells you, I hope I can pack the whole of my little time. He didn't even tell me how much time I have anyway. But I'll do some bit of introduction and give you the key, the pillars as they are, because this work is, of all the three I've heard about, this is the one in the earliest stage. We're just in the first phase. Actually, we have people on the ground now, still doing the field work. Climate change means so many things to so many people. For those of us in Africa, it just means, like the speaker that before Daniela said, something that the people cannot cope with. When you talk about the theories, they're talking about what they know on their land and how they have lived with this land for so long. What do they do with this shock now? That's the question. When you get to the ground, the academic theories take on a different form. It's a huge struggle to get the people to understand, look, this is not just about you. It is coming, it's all over the place. And so you have to respond, think globally and respond locally. That is the place where this study was conducted. As you can see, this is Africa. Here is the Atlantic Ocean. That's Nigeria. Here is the Atlantic Ocean. So the Atlantic Ocean is here. This is the Atlantic Ocean. Over here is the Sahara Desert. As you move up here, the land becomes a desert. As you come down, it becomes a forest. Now, this has serious implications for people who suddenly begin to witness something new. I've put some of the key indices there, but a very important one is the seasons. We have two seasons in Nigeria, the wet and the dry seasons. The rainfall period is 4 months to 8 months. It used to be that it wasn't so intense. With climate change, what the people have discovered is that the rain is heavily intense, falls within a short time, almost rips the entire place apart. And that's the problem of this part of Nigeria. Look at the land. The soil texture is clay, sandy, loamy. It almost has no capacity to hold water as it moves. So it just moves with the water. And what the people see is that in that short period, there is so much flow of water. And in the long period of the dry season, there is so much dryness. And they're dealing with these two extremes. I put this picture to show what it used to be. A and B are almost the same thing before the intensity that we're suffering now. As the rainfall gets intense, when you don't have the heavy flow, A and B is what you're likely to have. With the intense rainfall now, the land is beginning to look like these four figures, depending on where. And so in some places, whole villages are taken away. They lose their habitation, lose their means of livelihood, and become strangers within the same town that they have always lived. For those people there, where identity means so much, that is one of the things they suffer. That in their own land, they are now displaced and they are refugees. This is not a political situation, it's a climate-induced situation. Because of the extremes, in the tropical area, as I think you are aware, These are common things that the people suffer. Now, the interesting thing is, it's not just the climate change and the intensity of the rain or the intensity of the dry season. It is that they are not equipped, even without the intensities, to respond to the challenges of living. So as the rain gets intense, it increases the challenge they already have. And so what you have is that these, which constitute the morbidities, take on a new form. The people are almost like helpless to respond to this. It becomes everybody's problem. Some people we got some people to talk to them. Like I said, some people are in the field now, and Vincent, he is on the line. He will throw more light on this because I stay in England. Vincent is not in Lisbon now, but most of the time he's here. So Vincent, I don't know, you may want to introduce that project again. Are you with me?
Yes, you can go on. You can go on. I'll join. I was when you finish. Maybe doing question answers. Yeah.
Now we're expecting to deal with 5 states in the East, but we've been able to cover 2. This is our method of data collection. It is something that has to be integrated because you almost cannot isolate the challenges, whether it's in rainy season or dry season, whatever. They are so related that you have to take them in an integrated way. The researchers in the field use this method. We have been able to look at 9 communities using 65 questionnaires. 50 came back.
Yeah. Vincent there.
Maybe I should speak on this, right?
Yes, please.
Yes, please. Thank you very much. With respect to the data collection, so far so well, we've been able to conduct interviews, numerous interviews in communities in the 2 states, and more will be conducted in the coming weeks because they were unable to assess. They need permissions from local authorities to be able to conduct these interviews in most communities. It's been very troublesome, very challenging. We've had to write letters and letters and letters, and to see persons and persons and persons. This informs why we didn't have to go there the second time, because we cannot spend 2 months on ground to carry out data. It would be too much time to spend. So that's why we actually use our collaborators, research assistants, to help us gather the data. Basically, they've been able to gather data on, if you look at the topic itself, we initially intended to study just the socioeconomic impact of climate change, but due to the important areas we've discovered during the initial fieldwork, we decided to delve more into the health impacts, not just the environmental and socioeconomic impacts, but also equally also the health impacts. We have realized and recognized, as Father Dr. Dan would let us know, that there has been serious impact of climate change on the environment and then on health. People have been getting sick. We recorded more terrible ailments accruing. From the survey we conducted, we have distributed survey in 2 states, and 550 surveys were collected, and more will still be collected even when they go back to the field, to other states, the remaining 3 states, to gather data. But from the results we have so far, it shows we have seen that there has been serious impact on health, especially among vulnerable population. Talking about specifically children between 0 and 5 years, there has been increased case of malaria, flu, pneumonia, typhoid fever. Typhoid fever is not something you know in the West. It is an ailment that has to do with water contamination, and it has been very predominant in recent years in Nigeria, including other parts of Africa where water contamination is common during the rainy season. And then on the contrary, during the dry season, equally, there has been a serious impact of same malaria, because mosquitoes breed in polluted waters. during the rainy season, and during the dry season, they inhabit in abandoned farmlands and gardens. And this has actually impacted, rather led to the increase in mortality, in morbidity, as well as in mortality, including for pregnant women, for young people also. Though the mobility rate is high in young people, but mortality rate is higher for the vulnerable population, pregnant women, young children, and then the older generation. And the data we have so far collected indicates a high, like we can see in the screen. Yeah, thank you for presenting that. Like we can see in the data here, there has been a huge increase in the vulnerable population, especially with malaria, flu, typhoid fever, especially. And typhoid is a fast killer. Typhoid fever is one fast killer in the region. Cholera is another common thing that is common during the dry season because of poor sanitation. People are unable to get sufficient water to take care of their sanitation, their personal hygiene, and this has often resulted in high mortality, and especially in some communities where they still depend on. And one important thing, sorry, erosion is is one important focus of this study. During a rainy season, erosion have often occurred in communities. In Imo State, it is very, very active right now. In some of the communities I visited during the initial fieldwork in November, we noticed we did videos on different active erosions. Some happened 3 weeks before my arrival. Some were still ongoing even while I was there. And some communities are actually at the verge of extinction. In my own native community, the local government has actually placed an embargo on, or a restriction on movement around specific areas. Some of my uncles, their houses are already at the verge of being consumed by erosion. Erosion have moved through their farmland into very close to their houses. My dad was telling me some weeks ago that it is possible that some of those my uncles, my distant relatives, may need to be displaced in the coming months because of the coming rainy season. And with the intensity of rainfall and all that, most households are actually affected. In Anambra, sorry, it may take me a long time to keep talking about what we've discovered, but I would allow for time for Father Dr. Dan to continue. Thank you very much.
Well, when you have so much to put into a short time, that's what you get. But then the whole thing is to direct your focus to another side of Africa and how they are coping with this whole thing about climate change. It comes, when you say it in the classroom, looks beautiful. Oh yes, those who have the capacity, those who don't have the capacity suffer more. But when you are on the ground, that comparison does not exist. The people just know themselves. They don't know about those who have capacities. And in Africa, where you have political challenges, poor health systems, poor education systems, the whole thing about climate change just locks up, entangles itself with the existing challenges and make the whole thing very, very complex. Like Vincent has just said, we are also thinking in the course of this that what can be done. And that's the other phase of the project. After looking at the sites, talking to the people, and doing all the recording, what next? We're thinking that some level of empowerment, some kind of empowerment is important. As they say, it is better to light a candle than to cause the darkness. The whole thing is, for the people who visit, for those we interact with, what can we leave them? While we're thinking about how do you create a consciousness? We want to get people to tell their stories. We want to have those stories documented. We want to have the people share their different strategies of coping. Look at how other societies within the region have coped. And are they at the same level, even though they have the same, they're facing climate change? Like I showed you on the map, up north, it's Sahara Desert. Sahara Desert is pushing forcefully from the north and almost turning the whole thing, the whole land into a desert. And then from the bottom, where you used to have the rainforest, you have this erosion problem and the challenges we're looking at now. So what we're thinking of then is in our next phase to do a couple of things towards helping the people. That's our plan. Some mitigation and adaptation strategies after creating the consciousness that this is not just a local problem, it is not something mysterious, as Daniela was trying to get the English word. To demystify, it's not something that has to do with the gods. When you are in that side of the world, they easily explain things with, oh, the gods did this. The gods must be angry. Just to say, in this case, it's not a local god that is angry. If it's a god that is angry, it's a global god that human beings have to respond to. Hopefully, that will raise their capacity to adapt and help them form some mitigation, some policies. It's not the easiest thing to talk with governments because with the increasing long period of dryness, you have the herdsmen from the north moving down south now because it's becoming a little bit kind of habitable, manageable for the cows. That's creating a new source of tension. The government is struggling with that and creating all kinds of policies. Many of them do not work. It looks like an interesting project. It looks like an interesting project, but like I said, we have a number of communities more to go. The places that are marked in yellow are communities we haven't gone to yet. That whole block, the southern part of the country, form one kind of homogeneous unit. They have a common history face. So when this is complete, I hope the opportunity will be there again for you to listen to the whole story as it is. For now, we're dealing with a community that is struggling to come to awareness beyond their usual traditional ways, to respond in a situation where the health facilities are poor, the knowledge of so many things are not as they should be. It's not the people in the cities who face this. These are the people in the rural areas, which the politicians remember only when it is time for election. It's, yes, they don't forget them because their vote counts when it comes to election, but their lives do not count when it is time to save them. So, Vincent, I don't know whether you want to add something else before I can.
Yes, thank you so much. I wanted to add in that part of what we are actually trying to do, which are like some of the communities we may need to go back to very soon, as we proposed, is to educate the people on sustainable agricultural practices that would, in the historical analysis of our proposal, we stated that over the centuries before now, there has been the culture of planting erosion-resistant trees, but due to the high impact or high effects of urbanization and population growth, houses have been built, trees have been less trees have been planted, or less trees have been planted, and more trees have been have extincted. Have lost their places because people are cutting down trees to build houses and roads and markets and urban spaces. But you see, at the end of the day, these erosion resistant trees that do not exist anymore makes it easier for erosions to occur and reoccur. And we want to see how we can enlighten the people about the essence of planting good erosion-resistant trees, of cultivating good agricultural practices, sustainable agricultural practices that will help to ensure that crops that can hold the soil are planted. And then be able to educate the government. Those are the hem of affairs in governments and local communities, to be able to institute or create community-driven interventions where good gutters are created, water channels. We realized during the field study that that most communities do not have good water channels. That is why this erosion is possible, because water bodies are moving. They would always look for how to move. Because there are no good water channels in communities, erosion keeps occurring and will keep occurring unless and until it is properly addressed. In some of the communities visited, there is already a group of youths already. The local youths are already local youth groups are already making gutters, good gutters. But beyond each community, the water's ways that are made do not have a channel through which they pass, meaning that there are no good systems that will ensure that when these waters are moved from one community to the other, they will have a destination. In some of the places where we visited, some of the huge erosion sites, it is as a result of the different water channels of different communities that make up the huge erosion paths that waters have been able to create for themselves. In the past, we realized that in the past, there were rivers in some communities, but due to developments, these rivers have disappeared. We want to see how we can partner with the governments, like Father Dr. Dan lets us know. We want to see how we can discuss with the governments on creating good sewage systems, as well as possible, not really dam, but possible alternative river channels, so that when these waters, when water move from communities, they would have channels through which they move, good gutters, so that there will be less erosion for the future, and then the land will be sustainable. These are some of the things we are planning. Them for the health aspect as well. We intend to carry out health education on the need for people to prepare against malaria. Malaria is one of the deadliest diseases in the world. I want to quickly state at this point that Nigeria has one of the highest malaria burden in the world. Nigeria, for the past 10 years, have been the #1 country when it comes to malaria. And from this study alone, we were able to work with some other researchers on malaria. And thanks to the help of Professor Alexander Brew and the CEsA directorate, we were able to join a particular consortium to work on malaria. So this study actually has been very successful, successful as it is, because we are working with other researchers from different universities to work on helping to curb malaria in Southeast Nigeria, as well as globally. We want to state that at this point, we are still studying, and hopefully in the coming months, when this study will be rounding up, we will be able to come up with more educational or more enlightenment campaigns at the local level to educate the people on how to prevent malaria through sustainable practices. Thank you very much, and have a beautiful evening, everybody.
Thank you very much. That is so much for the whole thing. But the summary of it all is that when you meet these people, you give flesh. What becomes enfleshed is this statement that some people, some societies, or some communities don't have the capacity to respond. That you have heard that almost from every speaker that has taken the floor this evening. Thank you very much. Since it is a CEsA project, you will definitely hear more on this. Thank you very much.